the end of the year is here, and with that, also the beginning of a new year for many that are going to start their journey to United States and to become doctors in United States. So this video today is for those, for the ones that are making the decision if they want to do the USMLE steps, and I'm going to give you my perspective. There are many different reasons why would someone go to United States and do residency, trying to come here and not stay in your countries. So for you in South America, Asia, Europe, that want to make the leap and come here to practice and start residency, I'm gonna start with, are you doing it for finances? And I'm not gonna lie to you on this. Finances are a big reason around the world on why to do this. So, for example, if in your country the doctors are not getting paid an amount of money that is going to allow you to live in a certain way, certain standards, then for some people that's the reason. For some people it is the advancements, the technology, the how everything that happens around medicine usually starts in the United States. For some people is that. For some is the safety. You know how, for example, in my country Peru is super unsafe, and it's hard to live there anymore. So for me, United States is super safe. I live comfortably here. I'm not concerned about having my car break in all the time. It happens in some areas, but when you have money, you can choose where to live, and usually people choose to live in safe areas if you have money. I don't have a lot of money, but I am fortunate enough to be able to choose to live in a safer area. So it depends why it. I'm not gonna lie. For many people, say there's no money in medicine. There's no. If you're, what does they say? They say if you are going into medicine for the money, then you're on the wrong career. And you will see that in financial advice channels, medical channels, YouTube channels talking about this. And I have to disagree, because I'm a primary care physician, and just by practicing medicine and doing it well, having a passion for medicine, after residency I'm able to make good money, good enough to have a comfortable life, to be able to help my family in Peru, to able to live a comfortable life with certain luxuries, and to also to have time to try to get into different side gigs like this, like the YouTube channel that I'm starting. So, is there money in medicine? Yes, there is money in medicine. And is easy money? No, it's not easy money. It's a lot of work. So, like in any career, the more you work, the more money you make. So don't expect medicine to be high paid for little work. For some branches of medicine, it can be that, like for dermatology, plastic surgery, but for primary care careers, internal medicine, pediatrics, family medicine, emergency medicine, you have to work more to make more money. But compared to other careers, it's a good amount of money. So yes, there is money to make in medicine. There are so many options that you can follow after residency. It's vast, it's big. So don't worry. My advice is, don't worry about the finances now, because there is plenty of money to make. Many people are not happy about how is that money made, because many people think that you shouldn't work super hard to make money, but there is. So take that away and now focus on what else is in there. Are you going to do medicine because of the advancements and technology that is available in the United States? That's a great reason. I can tell you that for me, it has been better to practice in a country where I can see CT scan results, where I can see MRI results, when I try to help patients, than trying to just leave everything to the physical exam. It's more difficult for me to think, if I go back to Peru and I have to rely on physical exam, it doesn't seem safe. How are you really going to determine that a patient has an intracerebral bleed if you don't have a CT scan or an MRI? Yes, there are ways to have an idea to think about this, but can you certainly say to a person, you don't have a brain bleed right now, even if your pupils are dilated, you're fine? No, you can't. And so for me, having things at hand is very important. It's very, it fulfills me in terms that I can really guide a patient towards where they want to go. I can advocate. And that's another thing. I want to be an advocate to my patients, and I need the resources. I'm learning how to use resources. I'm learning how to impact my community, how to impact the Hispanic population that lives around my hospital, how to get to them. So I'm learning at a place where I have the resources and I can be there. Unfortunately, in my country, there will be so many reasons why I will be in a different position. I won't be able to reach anyone. So for me, to start learning the process of being a helping hand to my community is something I can achieve here. And I can learn from others that are already doing this work. And I can funnel this help to Peru by doing YouTube channels, by teaching, by doing talks on the latest and the greatest on diabetes, or the latest and the greatest on management of atrial fibrillation, guiding medical students. That's a big thing for me. For me, being here and learning all what I'm learning, and then talking to the new generations of medical students is a big thing. So this is something that I could, now that I look backward, I'm happy I'm here because I can do this from here. For others, let's say, what other motivations could it there be for you? So we talk about the finances, we talk about the technology advancements, we talk about safety of living in a country that you can choose to live in a safer area. So those are good reasons. Now, so the reasons are there. Anyone has different reasons. All reasons are valid. Is it expensive? It is very expensive to come here. I was talking to a friend that wants to do this, and we're talking about, so your first step one, $2,000, with including preparation, time, living, about $2,000 in the best situation. And within months after that, you have to take the step 2, another $2,000. So there you have $4,000. And we don't know what's going to happen to the OET or the 2CS, so that's another $2,000, probably 3, because I don't know what the requirements are going to be. They're going to make you travel, or they're going to make you take the test at a specific place. So let's say 3,000. So we have $7,000 at minimum. $7,000 just to get to the point that you can get a certificate to be able to participate in the selection of residencies, which is called the match. So about $7,000. Now, in order to increase your chances to be selected in this process, you have to have some experience or some knowledge of the American culture. How do you get that? You get that through what's called the USCE, or United States Clinical Experience. And these are also called observerships, externships, hands-on experiences. That, in the best case, if you find someone that doesn't want to charge you to do the rotation with them, or you don't do it through an agency, we're talking about in person about another $3,000, because you have to travel, you have to live in a place, you have to eat, you have to dress yourself. So about another $3,000. So you have $10,000 in the best scenario to be able to participate in the match with some advantage, with something in your pockets that say, oh, okay, this guy is a good candidate, this guy has something interesting going on. Okay, so we're talking about $10,000 to be able to make it into the election process. So that's the bottom line. $10,000, that's what you need to get it to this election process. Now, is it worth it? Yes, you can definitely make that money back just in residency. You can get that money back, and if you happen to ask that money to someone or sell something or be in debt because of that, don't worry. Get that money and get into the process, because you're gonna get that money back. Now, the second question is, some people are not mature enough to go through all the studying that is needed to take the steps, the exams. The exams are called steps. Some people are not mature enough and they don't study at the pace that is needed or with the focus that is needed. And for some reasons, some people are just not good test takers. So what happens if you score low? Of course, there is a specific number for you to pass, and you can pass with even low scores, and that is not an impediment to apply to the match. Many people will say, oh, you score low, so don't apply, it's a waste of time. No, there are many areas in the United States that take people with low scores. Why? Because there's a need for physicians. So even if you have low scores, keep going. The best thing is that passing the test is better than having an attempt. If you have an attempt, I would say still go. If you have 2 attempts in one test, meaning that you failed the test 2 times, then I would say, okay, maybe look at a different country. So my advice is, if you're about to start and you're willing to spend those $10,000, then change your mentality, focus, live in that little room that you are selecting to study for the next 6-8 months that takes you preparation for each step, and study hard, because it's getting more and more competitive. Yes, the best thing is to pass the test at the first opportunity you can. 1 fail, I think it's still doable. 2 fails in 1 test really lowers your chances. But I've seen many people match even with 2 attempts, 3 attempts in previous testing. It's harder, takes more money, takes more time, but some people do. So I wouldn't be discouraged by even if I have an attempt. But I will listen to the advice that others give in how to increase your chances. Now, we talk about the price, we talk about the motivation to do this. Okay, you have all that. And now you said, I'm going to start studying for step 1. So I'm going to live in this little room in my house, and I'm just going to get food under the door, and then take a shower once a week in order to be able to focus on my test. That's all great. But remember that I said that once you are ready to participate in the election process, they are going to look, who is this person? Okay, he passed all the testing, but now, why will we want this person? Why will we choose this person? Who is he? What has he done that is in alignment with his desire to pursue primary care in United States? And so that is your volunteering experiences, your service experiences, your ability to connect with others, your ability to explore other things that are related to medicine, but that you at this time, in your position of a student or a person that is just finishing and doesn't know anything about the United States healthcare system, could have done. For example, working with underserved populations, um, working in a homeless shelter, working in a church, not working, volunteering your time at a church, helping the elderly that go to church and I don't know, need someone to push their wheelchairs. Why? Because all that will be part of your curriculum, and when you come to the table, you will be like, in 2015, in 2016, I did this volunteering at church, helping um, transferring elderly people from side A to side B. You are listing that in your CV, in your curriculum, and they will ask you, okay, how was that experience? Well, this experience taught me how much help elderly people needs. And sometimes this is not seen by their family members, by their doctors. They are in need of sometimes physical therapy. They are in need of feeding, helping with feeding, helping with toileting, and this experience of helping the elderly at this church made me understand how important it is to identify these situations. Now, as a doctor, I look at a frail elderly patient and I say, maybe you need to go to physical therapy for that weakness that you have. Maybe you're falling too much because there is a weak spot in your back that needs to be worked up. Now I understand this. I think it's important to have any experience at a young age. So this is what happens in the interview. They ask you what that you done, and it doesn't necessarily need to be related to medicine in terms that you were a clinician or you were providing treatment, but anything that builds up your experiences that will be helpful. For example, volunteering at church, serving food to the poor. Like in many countries, we do that. That we, for example, in Peru, we during Christmas times, a lot of people collect money and make a big meal, go to a very poor area, and they serve food. Such experience that when you are there, you realize just by looking at people, maybe they are underweight. Maybe people in this community have an evidence of vitamin deficiency. Maybe this help that you're bringing today is not something that should be just a holiday or festivity related help, but something that someone in your government should advocate to bring in a more recurrent base. And that's something that you learn just by doing that. But see, as a person that interviews for this process, for me, any activity that you did before applying to the selection process helps your application. So don't dismiss any opportunity that you have to do any work. Now, it's tricky because you were saying that you have to study for 6 or 8 months in complete isolation. And some people will be like, oh, so how I study and how do I do this volunteering? Well, when there is a will, there's a way. So hopefully you have enough help at home to do this in a way that you can study for 6 months and not have to work. And during that time, find any volunteering spot. Just go to a church and ask, hey, can I come here every once a week to help with things, or can I be part of the kitchen soup project for these holidays, or can I help at the a local homeless shelter once a week? But since it's something that is happening once a week for the next 6 months, it builds up your experience. It becomes part of your trajectory to residency. So it doesn't need to be related to a clinic. It doesn't need to be you giving treatment. It just needs to be something related to primary care. And primary care has mental health. So you can volunteer at a mental health disorder clinic. You can volunteer at a hospital, not necessarily treating patients, but you can do any different things. We need a lot of help with palliative care, so you can volunteer with a chaplain that goes to talk to very sick people, and just go with the chaplain to his visits at the people that are dying. That will be very, very impressive in a curriculum. Why? Because we need people that are able to connect to people that are dying. That's a very important skill that's not easily achieved. So if you are in the beginning of this process and you want to do something, I would highly recommend to find a chaplain, a priest that is doing these visits, and go with him, learn with him. This will be very impactful in an application. Um, Working with minorities, working with underserved communities in your country through an organization, not alone, because when you apply to this match, we try to validate, or we try to connect to these places that you volunteered with, and we try to obtain verification of the process. So you cannot lie, and we do our best to connect with them to obtain the records that you were there. So that's all I can say for now about this process. I think for someone that's motivated to do this, it takes a lot of perseverance and an open mind to hear others, that have done this, and try to find someone that can guide you. My channel, I think my channel does a good job. It's pretty good. I'm an IMG. I require a J1 visa, which is a type of visa that is given to people that don't have a green card or any connection to the United States, and it's difficult to obtain, and it has some special rules with it. But now here, it's been how many years for me? I came in 2012, 2022, now 10 years. And I still work with residents, I still work with applicants every year through the YouTube channel now. I am all ears, so if you want to ask me something, put a comment down there, and it helps me to make more videos about this whole process. So congratulations on making the decision to start the process. Follow up for more recommendations. The next video will be on what to do during observerships and what's the etiquette of on observerships. So stay tuned, and I will see you later.